Hi, it's Sunday morning with Alan and Andy, and our return to healing topic of the day is going to be dermatology, which is interesting because here's the thing, Alan. Dermatology is about the hardest residency to get into. And if you look at these statistics of people who rank medical professions, our profession, primary care, is ranked as the most difficult and lowest paid.
Yep.
We have the honor of having two things like that. Dermatology is ranked as the easiest profession and the highest paid.
One of the highest
And
paid. You're exactly
they
right.
have the ratio of how hard you work to how much you get paid. Dermatology wins that battle. And the funny thing is, back in the 1980s, they were more like us. You know, they were lower paid. They were among the lowest paid. It wasn't hard to get a residency, because they were just cutting things off. But then they did something that other specialties have done since. They hired a publicity agent and they hired people to go lobby in Congress. And what they did is create this idea of skin cancer epidemic. And all the ads came out. There's a skin cancer epidemic. See the dermatology, get your screening, get your annual screening. And the screening became a ritual. And they also merged, which we should talk about, with the sunscreen industry to say we need everyone to have sunscreen on, stay out of the sun. You got cancers, we got to cut them off. Then they invented this procedure called a Mohs procedure, which basically what you and I could cut off in the office, now they
In
go
one
under
minute,
1 minute. They for $30, I think, is what we charge. They go in and have this $30,000 test, which accomplishes the same thing, uh, other than putting people at risk. So how did we get this profession that claims to save people's lives? Oh, one more statistic I want to throw out, Alan, is that since this happened in the 1980s, skin cancer deaths have not improved one bit. We're still
because
just
so a few things you brought up, and when we decided to do this topic, I just started getting angry because it's such an example of how our healthcare system is effed up. You know, so number one, the dermatologists were really smart back then. Okay. They came out with the publicity campaign, like you said, but they've also limited their residency slots. So only X number of dermatologists come out per year. And I could tell you the average, dermatologist works, 3 days. Some will work 4 days a week. All right. Uh, no evenings, no weekends, no access to care.
no
And,
hard decisions either.
right, their patients don't die,
Yes.
take it off or not, or here's my choice of low potency steroid, moderate, and high. And they probably got upset when they came out with these biologics like Dupixent because they actually had to think about these drugs and, oh, I have to write a real drug now. And like, what am I going to do? But they limited their field. And the 95% of dermatologists are making a $500,000 a year or more to 1 million, and they're cosmetologists. Like you might as well be an aesthetic person, go to the state and get a license to do eyebrows and nails and lashes because that's what they do. And they inject Botox and stuff like that. And it's just a crock of crap. It's amazing how they've allowed this field to develop that these people are making a 500,000 to 1 million or more if they're in a fancy Manhattan practice, and people are paying for things they think they need. And I crack up because it's almost once a week I get a patient saying, "Oh, my sister said I should get a referral to a dermatologist for my annual skin exam." And I'm like, all right, take your shirt off. I'll give you the one for free. It'll save you, parking and a copay of a specialist and all that. I said, it's ridiculous. I said, I've been doing dermatology since I'm a resident.
Right. This
It's
is part of what we do. But also, it's also really important to know that there are different kinds of skin cancer. So when they created this, skin cancer detection base, I remember I was like this young doctor. I just started, I moved down to Maryland and I had this I decided, okay, I was a lifeguard. I probably am at high risk. I'm gonna go see a dermatologist and get my annual skin test. And this was a long time ago, right in the 80s or whatever, 90s, I don't know. And I went to Hopkins because that's in my backyard. And the guy looks at me and says, "What do you want me to look at?" I said, "I got nothing particular. He said, so you want one of those skin tests so I could figure out if you have cancer? He said, yeah. He said, let me tell you, you're a doctor, right? I said, yeah. He said, those are worthless. He said, we have studies showing that people who get skin tests like that every year do worse than people who don't get skin tests. It certainly hasn't reduced any skin cancer deaths, and we're going to look for stuff that you might as well never remove. Removing squamous cells and basal cells typically is not necessary. All my older patients are riddled with that stuff.
Well,
And there's studies that show when you cut it off, there's a 20% risk of injury from the procedure. Whereas if you leave it alone, no one dies from these cancers. You
right.
could, and let me make a caveat, because I once said that and someone said, well, my brother-in-law died from, okay, there are some that spread.
Melanoma. That's it.
Melanoma. That's what we're looking for. And it's very rare when you get older to have a melanoma anyway, but you'll notice a melanoma. Some melanomas show up in your under your nails, in your gums, in your eye, which you can't tell. But the screening doesn't doesn't change the outcome. And that's the whole point. Any screening test like anything, whether it's mammograms, colonoscopies, or PSA, if it doesn't change the outcome, if you're going to die at the same rate, but you will be put at risk from the procedure to remove this phantom cancer, that's a problem. And
And
and they're really preying on old people where I am, and I end up one of them, my old people said, "Well, you said this was normal, but it turns out to be a cancer."
right,
I said, I just said it wasn't dangerous. I never said it was normal. There's a
right.
lot of things like that.
And we call these cancers in medicine, I didn't term it. I don't know who termed it, turtles. They're not going anywhere. They're not going to hurt you, and they just sit there moving a little bit every day. And removing them is the harm. Infection, and even more than that, people are permanently scarred when they have benign things removed from their body for no reason. People think that, plastic surgeons and dermatologists are magicians. Like they point and it's gone. Like that's not the reality. You take things off someone's skin, the best plastic surgeon in the world, there's going to be a scar. Like that's just how skin heals. It's absurd.
Well, then you could go to the dermatologist to have these laser procedures to remove the scar, right? It all just gets it reminds me of the cartoon that I saw that said, a cured patient is a lost customer. But not in our medical system because the
Yeah.
cure creates new problems, and then you're actually more of a customer the more you see people like
Exactly. And
these
and while
guys.
you're there, you could get your tattoo removed, that you got when you were drunk for some stupidity. It's
Right, and
like,
then get drunk and get another one, and then
hmm,
have that it's a cycle. But yeah, people really think their lives are being saved by going to these dermatologists, and the dermatologists through their campaigns, their advertising campaigns, and it's still on TV. You could see these ads all the time that we are saving your life. There was a funny Seinfeld episode about it, if anyone remembers when he was dating the dermatologist. And he says, "Oh," and she says to him, what does Seinfeld know? She says, "Well, I am actually a lifesaver. I save people from skin cancer." I'm like, "Really?" Because I when I need something cut off that I can't do, I skip the dermatologist. I send them to a surgeon. That's not
absolutely. I agree. If I think someone's got a melanoma, sometimes I'll biopsy it, but most of the
right.
time they're not. So I do biopsy them and they're not. But
Right.
I've had a couple in my career, and in 40 years, I did have one patient die from a melanoma. Melanomas can be aggressive. We know that.
Right.
But there's very few non-pigmented melanomas, but you'd have to take off 50,000 skin lesions to pick up one if you weren't smart in what you were doing. And people aren't smart. So I laugh. In New York, they've popped up like roaches. They're called the dermatology specialists. So they literally opened up one. I cracked up right next to one of our safety net hospital, urban inner city Medicaid clinics, essentially. That's the people we take care of. They opened up right next door. And I was like, what are these people crazy? Like they're opening a for-profit practice right next to a Medicaid clinic. Are they expecting to get the patients from there? And I looked in there. I went in there one day and I said, is the doctor in? Can I speak to them? Oh, we don't have a doctor here. They have a nurse practitioner. And what does it take to teach a nurse practitioner or a PA how to remove a lesion? Well, You clean it with a little betadine. You give a little injection of local anesthesia. You take a knife or a skin curette, you scoop it out, and you take an electrocautery and burn it. I could teach someone to do that in 5 minutes, and they're now the dermatology specialists.
And those specialists are walking around nursing homes, seeing everybody, and these, 90-year-old demented people have a squamous cell sitting somewhere that they've had for 20 years, and they cut it off. And they get paid big bucks for this. The reimbursement for you and I to do it is far lower than for them to do it, which is another thing we could talk about. How, like, if I read an EKG and a cardiologist reads an EKG, they're two different payments for this simple thing.
Absolutely. And the same with the dermatologist. But I laugh. So when I take off a skin lesion, I don't need to be bad, but a little bit, I hope maybe it is a skin cancer. Because if I take off a benign mole on someone, we get like $25. And if it's a squamous cell or a basal cell carcinoma, again, neither of which will kill you, I get like 125. Oh, I'm going rich
Right.
there. It's like, all right.
Right. Better to find the stuff, the benign stuff. Yeah, we were talking before we got on about when we used to be at the Lown Conference, which was the big think tank. It still is, big think tank
Yeah.
in Boston that looks at overuse, overtreatment. But they used to have an annual conference we went to where
No,
we,
that Andy, they're going to have one this year. We got to talk about that.
we could go to.
Yeah.
Oh wow, that would be excellent. But because they were the best conferences, honestly, they the best people talking. But there was this one guy who was a dermatologist. He used to be in Hawaii and he moved to Vermont, I think. And he did a study showing in a single practice the the rate that the each dermatologist billed Medicare for basically removing either through cryosurgery, which is freezing, or scalpeling these skin lesions. And he was, of course, the lowest biller. He was like, I don't know, 10,000 a year. But there were people in his practice over the same period, which was a year, making a couple million. And because they just did everybody. And he said the outcomes were exactly the same in terms of skin cancer death, which is really the only measurable outcome we care about. But they don't care about that. So even when we remove, because melanomas, the ones that are ultra aggressive, will have spread before you even see them.
Yep.
Removing them is useless, and the other ones aren't ultra aggressive. So that's what this guy said too. This guy from Hopkins. I said, well, melanoma will kill everyone. He said that's what they'd like you to believe. He said, but the aggressive ones will kill you and there's nothing we could do about that. They're spread. He said most melanomas don't kill you. He said they're like the other things. He said so is another he said another lie from my profession is what he said. You could see this guy was honest and angry, and the fact I walked in there was really fired him up. But
Well, that's like us, two angry schmucks, you
we're
know?
two angry schmucks because we see this blatant abuse of people's trust.
Yeah.
And at the same time, this salesmanship job that has succeeded. And let's talk about a second part of this, Alan, which irks me even more. This same guy I talked about signs his emails united in the battle against sunscreen. So the sunscreen industry has basically jumped on the dermatology industry's idea of how to advertise. And their basic view is, if you use sunscreen, you will not die of skin cancer. Let's just get it right out there. That's not true. I mean, it's never been shown. I read this book, Anti-Fragile, recently, and if the guy who wrote it knows more about healthcare. He was a day trader on Wall Street, but he figured everything out. He was willing to even say some really controversial stuff that's true. But he said, look, our skin has evolved over a long period of time to let in the right amount of vitamin D and other things that keep us alive. Our skin is incredibly important for our immune system. The things we activate from sun are incredibly important to protect us against cancer, against infection. In fact, recent studies have shown, and you and I wrote an article about this, Alan, that the vitamin D you take by mouth will raise your vitamin D levels, but it is inert. It doesn't work. It doesn't do anything. The only way to get vitamin D is to activate it through the skin. So we are now covering our skin with this stuff that has not, again, not reduced skin cancer deaths at all, but has prevented the absorption of really important things, including activated vitamin D, that prevent cancer. So here's
Right.
this great irony. We're putting this on to prevent cancer, and we're causing cancer.
Absolutely. And it's never been shown to prevent melanomas. Like
Right.
it's totally ridiculous, but it's a billion-dollar industry, and all this is billions of dollars in industry and wasted healthcare. And people don't talk about, the negative things of having stuff done to you that you don't need. Whether it is an infection or a scar or just the worry, oh my God, I got basal cell carcinoma. Like I might die from this. Like, it might disfigure my nose. So I want to tell a story. So about 6 months ago, I have this woman come in. She's like 74 or 76 years old in that range. And she's got a little dot on her nose. And she came back and she says, I went to the dermatologist. They did a biopsy. I mean, literally the dot was like a dot. And they said they they scraped it off and it's a basal cell carcinoma right here on the tip of her nose. And I'm going for Mohs therapy. So, for the folks that don't know, Andy talked about it earlier. They literally shave off a microscopic piece and then they go look at it under the microscope so they could charge you $20,000 to say they're doing this. Okay. And if they see two cancer cells, they're going to scrape again and then they're going to go do it again. And so the woman comes back, 3, 4, 5 months later, and she looks like Bozo the Clown. She's got a red button on the tip of her nose, this round circle here. She literally looks like Bozo that says, "Oh, I had the Mohs, but they saved my life. I don't care. I have that round circle on the tip of my nose. I'm alive. And this is what people think.
This is what it always is. I saved my life and just in the nick of time. When I tell people, you don't have to do that, and they go, they say, you were going to let me die. I've had actually people tell me that you're going to let me die, but
Yeah.
I'm like, this wasn't going to kill you. I said,
So,
but now you look like Bozo the Clown, and it
so,
could be worse than Bozo
yeah.
the Clown. You could have part of your nose removed.
And we actually didn't talk about the worst one yet. So the worst one, in my opinion, is actually actinic
Oh,
keratosis.
yeah, that's the
So,
worst one. Yeah.
so for the folks online, actinic keratosis is like most elderly people have it. I have some. You rub your skin like this and you go around and you feel a little piece of sandpaper there. And you're like, oh, it feels like a little piece of sandpaper. Oh, that's an actinic keratosis. That is, quote, pre-malignant. Like, 1 in 10,000 is going to turn into a basal cell
Right,
carcinoma,
which will still won't kill you.
which still won't kill you.
Right.
But dermatologists are probably freezing and burning billions of dollars worth of something that is totally useless and has about a 90% 1 year chance of just going away. And they're making billions of dollars, and people are dying from hunger and obesity and not getting the right care they need. But the American Cancer Society and the American Dermatological Society say, we're saving the world with Mohs therapy.
Well, that's the whole thing. And like I said at the beginning, this total abuse of trust and really it pulls us back in the medical world to when people were just pushing these carts and promising the world, and they were snake oil salesmen and patent medicine salesmen, and they promised that they would save your life if you take this elixir. Why is it the only difference now is that they are considered legitimate
Yeah,
and
because
they
they
are
got a
making
degree.
billions of dollars compared to
Yeah.
these pushcart guys who were not.
They
That's
got a
the only
degree.
difference.
They got a degree that they're making money on, and read our book, A Return to Healing. You will see, snake oil salesman is one of Andy's favorites, but it's so true. It's so true. Most of these physicians, especially dermatologists and others in certain fields, are selling you snake oil, and people are buying it and spending billions of dollars. And it's adding to the healthcare system. And some of this stuff is paid for by insurance because it's considered
Oh yeah.
actinic keratosis and basal cells and
Yep.
squamous cells. And there's, a million treatments. It's just someone needs to wake up and say, we have one of the worst healthcare systems in the world. And we are hurting people more than helping people. Let's go back to the basics of primary care and let's make people healthy. Let's go back to lifestyle medicine and stop with paying these specialists for procedures. And let's pay for primary care and thinking about how to avoid spending all this money to make people more unhealthy and more worried for things that is not going to make a difference in their lives.
Yeah, yet another fake epidemic that they've created. And I always tell people that the basic business model of the medical system is to scare you to death
Yeah.
and then do crap to you that is going to harm you. But you think your life is saved just in the nick of time. And yes, if they didn't pay so much for these procedures like Mohs and other things, then guess what? They wouldn't do them. It's a very simple financial math. It's a lot more it's a lot more difficult to talk about lifestyle medicine and to help people through that, but we get paid nothing for that. It's much easier to cut off a lesion. I always say one lesion cut off could be a day of patients for me in
Yep.
terms of reimbursement. And that's the sad reality is our payment system.
And how many people did you help in that day?
Right.
Truly help, and
Yeah,
change
you
their
truly
life.
helped. You truly helped, and it took a lot of brain power and a lot of compassion and a lot of focus for me to get through the day to help all these people. A labor of love, but they just take out their knife and cut, and they've just said, and then they say, "I saved your life." We don't say that we don't lie like that. So we're just like the guys out in the dirt helping people. But anyway, so we'll keep. There are a lot of other topics very similar to this one where these specialty societies have advertised and created this illusion that they are helping you for their own profit, which they don't. No, they're saints. They're saints. So we'll talk about some of the other ones moving forward.
And we know that all these pandemics we create is truly not a pandemic. It's just we're diagnosing things that have been there forever, like
Yeah.
skin cancers, because they didn't kill anybody
Right.
except
They left them alone in the past. They were
yeah,
smart enough to do that. I always wonder, Alan, whether the dermatologists are like the guy we know, we met is like infuriated by what his colleagues are doing.
yeah.
But are these people just doing it because they believe it's helping people, or do they know the reality that they're just fooling people?
My gamble bet is it's 50-50. I think
Yeah.
there's some people that really think they're doing a good thing and they believe, you know, they bought the Kool-Aid kind of thing. And then there's the others that are just, getting their Bentleys and Lamborghinis and stuff like that.
And they just got to keep up with the other dermatologists. Okay, Alan, well, have a good cold Sunday.
You too. Keep warm.
Okay, you too. Take care.